Hi guys, today I want to talk about the placebo effect because I think it is really interesting, more than interesting, fascinating, and also quite useful. I'm sure you've already heard about the placebo effect, but we're just going to take a more in-depth look at it today, and I'm also going to tell you some of my experiences which are kind of, well, not necessarily exactly related to the placebo effect, but in the same. So let's start at the very beginning. Placebo is from Latin I shall please, and it is a substance or a treatment with no active therapeutic effect. And of course it's used in drug testing and medical research, and also may be given to a person to deceive the recipient into thinking that it is an active treatment. When it's used in investigation, we call it a control, when obviously with the consent of the person, the information is hidden from them whether the drug is active or inactive. So this psychological phenomenon in which the recipient perceives an improvement in condition due to personal expectations rather than the treatment itself is known as the placebo effect or placebo response. And there's still a lot of research on this subject going on. Common placebos include inert tablets like sugar pills, vehicle infusions, sham surgery, and other procedures based on false information. And they can produce some physiological changes, such as changes in heart rate, blood pressure, chemical activity in the brain, and sometimes a purely subjective effect in which the patient reports improvement despite no objective improvement in the condition. On top of the individual placebo effect, the placebo effect can also be a component of real treatment with real medicine. For example, pain-killing and anxiety-reducing drugs that are infused secretly without an individual's knowledge are less effective than when a patient knows they are receiving them. Likewise, the effects from stimulation of implanted electrodes in the brains of those with advanced Parkinson's disease are greater when they are aware they are receiving this stimulation. And very interestingly, fake meniscal surgery is found to be equally as effective as the actual procedure. So it's not just simply a case of a sugar pill can have a placebo effect, because it really depends on a lot of superficial things. It depends on the size of the tablet, whether it's like a capsule or a traditional tablet, what color it is, and even the packaging and the name in which it comes. For example, large pills seem to work better than small pills. Colored pills work better than white pills. An injection is more powerful than a pill, and surgery gives a stronger placebo effect than injections do. If the substance is viewed as helpful, then it can heal and have helpful effects, but if it is viewed as harmful, it can actually have negative effects. When this happens, it's known as the nocebo effect, not placebo. Nocebo is Latin for I will harm. And you can use the same sugar pill presented as a stimulant, and that will have an effect on heart rhythm and blood pressure. But when it's administered as a depressant, exactly the same pill, the opposite effect will occur. And even perceived ergogenic acids can increase endurance, speed, and weightlifting ability, leading to the question of whether placebos should be allowed in sports competitions, which is a very interesting question and idea. So it is all in our mind, but it does cause real physiological effects that can be seen and measured. For example, with Parkinson's disease, placebo relief is associated with the release of dopamine in the brain, so dopamine is actually released. In depression, placebos reducing depression affect many of the same areas that are activated by antidepressants, with the addition of the prefrontal cortex. Even with caffeine, placebo-caffeinated coffee causes an increase in bilateral dopamine release in the thalamus. And glucose, the expectation of an intravenous injection of glucose increases the release of dopamine in the basal ganglia of men, but not women. And then this next part I found really fascinating. The brain has control over body processes affected by placebos. For example, so you can condition your brain to do something in response to a placebo, kind of like Pavlov's dogs. One example is a neutral stimulus, saccharin, which is just a sweetener and doesn't really do much, is paired in a drink with an agent that produces an unconditioned response. For example, that agent might be cyclophosphamide, which causes immunosuppression. And then the brain learns this pairing, that these two things go together, saccharin and cyclophosphamide. And after that, only the taste of saccharin, just by itself, without the added cyclophosphamide, is enough to cause immunosuppression. And a new conditioned response via neural top-down control. Another possible negative consequence of the placebo is that it can cause side effects associated with real treatment. For example, people who have already taken an opiate can show respiratory depression when they are given it again in the form of a placebo. So it's not really an opiate this time, but their body responds in the same way as if it was, with the same negative consequences. And even withdrawal symptoms can occur after placebo treatment. For example, there were women who had been on a placebo of hormone replacement therapy for menopause for an average of 5.7 years, and 4.8% of those on the placebo reported moderate or severe withdrawal symptoms, compared to 21% of those who had the real hormone replacement. So not as many, but still quite a lot to be having imaginary withdrawal symptoms. And in recent decades, the placebo effect seems to have increased. The placebo effect is believed to reduce a pain in two different ways. One way is that the placebo initiates the release of endorphins in the brain, which are natural painkillers. And the other way is that it changes the perception of the pain. For example, a person might reinterpret a sharp pain as just an uncomfortable tingling. So I'll tell you a little story about, I suppose, what we could say is a nocebo effect that happened to me, that I experienced, and that is to do with wisdom teeth. So when I can't remember when it started, but I started to have wisdom tooth pain probably when I was about 19, more or less, and it wasn't very painful. The pain would come and go, just in this one, on the lower left side of my jaw. Maybe it would be, a bit painful for a couple of days, and then it would go away for months and months. And this went on for years, actually, and the pain became more frequent and stronger. It was never really bad, but it was just a little bit irritating. So finally, when it was getting worse and worse, and I hadn't been to the dentist in years, I think since I was 18, when I was about 27, I decided to go to the dentist because I was thinking maybe the tooth wants to come up. None of the other wisdom teeth had appeared. Maybe the tooth wants to come up, but maybe it's trapped, because there was sometimes swelling as well as the pain. And so the dentist looked in my mouth and she said more or less the same thing. She was like, maybe there's some problems going on there where it looks like there's a bit of swelling. Maybe the tooth is not quite able to emerge. So she sent me for an x-ray. And then when she got the x-ray, she had a very confused and surprised look on her face. And it turned out that I had no wisdom teeth at all. Some people just don't get them. They just don't have them, and they never come. And so she couldn't really explain what this pain and lump was. So she just said, oh, maybe you've been like biting your gum without realizing, or doing harming the back part of your gum with your upper teeth. If the pain persists, come back and see me again. She didn't really, I think she just didn't really know what to say. And it also coincided with the time that I had the pain in my tooth on that very day, the pain and the swelling. And the next day, I woke up with no pain and no swelling, and it never came back. The pain never came back. So I really think that that was a kind of nocebo effect. I just expected that I was going to get wisdom teeth, so I expected that they would be painful, and somehow just created the pain. It was real pain, I didn't imagine it, but it was obviously just created by my brain. And then when the proof was laid out in front of me that it was impossible, there was no way to continue believing in it, and so the pain went away. I always thought that was very strange. Okay, so the next thing moving on is not exactly the placebo effect, but more about the power of the mind. And I want to talk about some Buddhist monks who are able to do some pretty amazing things. And they were studied a couple of decades ago by Herbert Benson, a scientist from Harvard University, and he visited remote monasteries in the Himalayan mountains throughout the 80s. And he found that the monks had really incredible control over their bodies. He found that through meditation they could raise their surface temperature while keeping their core temperature normal, but also there was a group in Sikkim in India that could lower their metabolism by 64%. And that's quite a lot, that's quite a significant amount. For example, you usually only lower your metabolism automatically by 10 to 15% when you sleep. So 64% is really dramatic. And the scientists used to watch the monks spending a night out on the mountains in the open air in the Himalayas, and they were just dressed in their simple wool robes. They had no extra clothing on. They slept on the cold rocks, and they didn't even sleep together beside each other for body heat. They were separated. Temperatures apparently reached 0 degrees Fahrenheit. The altitude was 15,000 feet. And really, they probably should have died from exposure, but the cameras did not even catch them shivering at any point. When they got up in the morning, they were all completely fine, and they just walked back to their monastery completely calm. And by this stage, of course, the camera crew and all the scientists were absolutely freezing in spite of their layers and layers of protective clothing. It's not yet known how monks managed to generate this heat, but magnetic resonance imaging scans of the monks' brains while they meditate have shown marked differences in blood flow to the entire brain. At the same time, certain areas of the brain become more active, specifically those that control attention and autonomic functions like blood pressure and metabolism. There was another study that I read about. There was another article that I read about this, which is even more impressive, in which instead of just sleeping out on the rocky ledge in the cold, the monks actually had wet sheets draped over them, and they were drying the sheets with their body heat. And the moment the sheets were dry, the attendants would return and put another wet, cold sheet on top. Imagine like in the freezing air outside. That would be a really horrible experience for a normal person. And the monks were required to dry 3 sheets every night. So obviously it's not the same as the placebo effect, but I'm just mentioning this as an example of the power of the brain over the body. And I'll tell you a bit of a strange story of my experience. This was years ago when I was about 18, I think. And I had a mole under my arm, and I don't know how long I had been there, but I remember at some point it started getting a little bit itchy. And I just presumed that maybe it was my deodorant or perfume or something making it itchy, so I changed deodorants. and it continued the same, so I changed deodorants again and nothing changed. And then I started to think, this is a bit weird. This is definitely a bit strange. But instead of going to the doctor like I really should have to get it checked, I decided that I was going to deal with the situation myself. And I'm not recommending this, but it's just part of the story. And so every night before I went to sleep, I would tell my brain to tell the mole or freckle to go away or stop being dangerous, to not multiply. And I would imagine like the cells, you know, the way instead of cell division it's like 1, 2, 4, 8. I would imagine it happening the opposite way: 8, 4, 2, 1, 8, 4, 2, 1. And after a while, the texture kind of began to change, and it started to change really quickly. It was like, it wasn't so itchy anymore, but it seemed to be a little bit bigger and a little bit squishier. And then one night I was looking at it, this is kind of disgusting, I know. I was looking at it, it was like really squishy. It had just like lost all texture of skin, and it was really loose as well. I was like, oh my God, it's going to fall off. And I went to sleep, and when I woke up in the morning, it was gone. I couldn't even find it in my bed. I was like searching my bed sheets for this random freckle mole thing. Couldn't find it. And it never grew back. So it could be just a coincidence. I'm totally aware of that, but I still think it's very interesting. Even if it was not dangerous in the first place, perhaps somehow I was able to get rid of it, or even if I wasn't able to get rid of it because I believed I could, the placebo effect helped me. Who knows? I've done a couple of similar things since then with not scary, not serious things. Like, I mean, I know this sounds really crazy, and of course it could be all just coincidences, but I remember one Halloween, I got a weird cyst in my nose, and I remember it came on Halloween because I didn't go out that night. I was after spending 2 weeks cleaning this house of an old man his house was so filthy, and he had cataracts, so he didn't know it was filthy. And the cleaner had been going and pretending to clean, and she wasn't. She was like cheating him. So I went and cleaned the whole place, and the kitchen was like so disgusting. I think I used like a couple of bottles of bleach in that kitchen, like constantly every day I was working with bleach. And at the end of it, I got this weird cyst kind of just in my nose. And it was, it just came all of a sudden. It was itchy, painful and hot. And then it just was just like a weird lump. And it stayed on my nose from Halloween till February. And eventually I went to the doctor on the 8th of February, and she said, yeah, it's just a cyst and it's in a position where it's not really worth cutting it open or anything like that unless it grows or unless it starts to give you problems breathing. And I asked her, will it go away by itself? And she said, no, they don't usually do that. So in my mind, this was like a challenge. I was like, oh really? I didn't say it to her. I said, let me see what I can do. So I got to work with my 8, 4, 2, 1. And in 2 weeks it was completely gone. Once again, it could be a coincidence. But the way I look at it is, you know, your brain is controlling your body. So if you can control your brain, you might be able to get some stuff done that you wouldn't otherwise. Even just convincing yourself that it's possible, maybe you can make it possible. And I mean, take the monks for example. I don't want to make little of their dedication, their lifetime discipline and practice of meditation, which I'm sure takes a long time and a lot of effort. But when it comes down to it, at the end of the day, they have the same raw materials as you. They have a brain and a body. They just use it in a different way. But if they are capable of doing something so dramatic as drying wet sheets out on freezing ledges in the Himalayas, then maybe you and I can do something like about 1% of that in order to cause some change or reaction within our own bodies. So I have a couple more stories like that, but they're kind of boring, really. I know it probably sounds totally crazy, but as I said before, I'm aware that it could be just a coincidence. I don't necessarily believe it without any real solid proof. But on the off chance that somebody has done the same, let me know what happened to you.